The big news of the morning is, of course, that David Clark has been more than mountain biking. He's been to the beach and he's been in a pile of trouble with the Prime Minister. And if it hadn't been for COVID, he would have been sacked by now, but he remains the Health Minister this morning. Morning to you.
Good morning, Mike.
When you set out on that first sojourn with your family on that first weekend, the 20 k's down the road to Doctors Point Beach, did you know you were breaking the rules?
Clearly, I wasn't thinking, Mike. I made the decision to go. I own that decision, and I got it wrong.
Did anybody say to you, like the kids, are we allowed to do this, Dad, or your wife, or anything like that?
My wife phrased it, and I got it wrong. I made the judgment. I said no. The important thing is we're staying in our bubble now. I just got that wrong.
You got it wrong, as in you thought you were doing the right thing, or you said, yeah, it is wrong, but don't worry about it. We'll go anyway.
It doesn't matter. I make no excuses for it, Mike. I got it wrong.
And when the bike story came up the other day, why didn't you mea culpa the beach trip?
I confess that it wasn't until I was preparing for a select committee today that I went through. I knew I was going to have to answer questions about the bike trip, and I thought, is there anything else I could have done which might have breached the rules? And when I went back and looked at it closely, I realised that obviously I had let myself down on another occasion and let down New Zealanders, and so I offered my resignation to the Prime Minister.
And what did she say, by the way?
Obviously, she was pretty unhappy about it. I think that's what you'd expect. I've received messages from around New Zealand, texts, and I've seen on Facebook people are angry and upset, and I completely understand that.
Did you mishandle the bike thing in the first place, given that Grant Robertson and Ardern were fronting for you and you didn't front at the time and front and apologise to New Zealanders at the time, and that might have helped your cause then? Honestly, Mike, I don't think it matters. I've just got this wrong, and I've made a fool of myself, and I need to be really clear on that and apologise to New Zealanders, and I've done that. How much of it's arrogance?
Look, I would accept that I've got a long way to go to build the trust of New Zealanders. This is the Health Minister in the middle of a global pandemic is an incredibly important role, and I've got a way to go to rebuild the trust of New Zealanders. Is
the inference the fact you're still in the job now because of COVID, that you will not be in the job once COVID is over? In other words, you have been essentially sacked, you're just holding your job for now because you have to?
Well, I serve at the discretion of the Prime Minister. I can assure you that I will be absolutely focused on that job at hand, because New Zealanders are making huge sacrifices at this time. Some are not going to the birth of their children. Some are not able to go to the funerals of their loved ones. We've moved early as a country into lockdown. People are making those sacrifices so we can break the chain of transmission, and I've been given the job of making sure that I continue to do a good job as Health Minister, because that is what serves those sacrifices best. But clearly, in this instance, I've got it wrong, and that's why I offered my resignation.
Shouldn't you resign once this is over, though? Because this is a sackable offence. Under any other circumstance, this is a sackable offence, isn't it?
The Prime Minister's been very clear on that were we not in the current situation, I would have been sacked.
And therefore, once we're out of this current situation, you should still be sacked then, shouldn't you?
Look, I serve at the discretion of the Prime Minister. That's not my judgment to make.
Well, it is. I mean, you could offer your resignation again and go, look, I've got you through this, and out the other side I still made a complete fool of myself, and therefore I quit.
It's completely the decision of the Prime Minister. I have made it clear that I've got this wrong, and I'll be judged accordingly.
On the bike ride, when you parked your car in the car park with no other cars at all in sight, did it not occur to you that maybe there was a problem?
Mike, I honestly don't think it matters. I got it wrong, and that's what I've apologised for, because it was clearly an error of judgment.
I'm just trying to work out how deliberate it was, because that then is a difference between an error in judgment where you could plead, I honestly didn't know, or I'm just thick, or I was deliberately doing this knowing it was against the rules and I'm better than everybody else, therefore why shouldn't I?
Look, Mike, I don't think it does me any favours to get into arguing the technicalities on it. I got it wrong, and people expect the Health Minister not just to follow the rules, but to set an example for other New Zealanders, and I failed to do that. And so the task ahead of me is to make sure that I don't make any more errors, and that I am focused on making the most of the sacrifices New Zealanders have been being made in the lockdown, and do my job well.
Shouldn't have to ask the question, but I take it this is it, there is no more?
No, that's right. You can imagine when I discovered this last night, when I was preparing for the select committee, when I went back and looked at my records of anything I'd done, I went back through pretty thoroughly because it was just hugely, embarrassing is understatement. I immediately wanted to offer my resignation to the Prime Minister. It was an error of judgment, and so I have been back through thoroughly and looked at the other actions I've taken over that period. Just recognising the huge sacrifices New Zealanders are making, and the number of text messages I've had over the weekend, the Facebook posts I've seen. I know how angry and frustrated people are at the sacrifices they're making, and they expect their health minister to show leadership on this, and I failed to do that.
We're being told by the Prime Minister's office, as regards your future post-COVID, to wait for her 1 p.m. press conference this afternoon. Do you know what's in that press conference?
I don't. That's the Prime Minister's office.
So you will be as surprised as anybody as to what she says?
All I know is that the Prime Minister has told me that I need to get on with my job, and she, like other New Zealanders, expects me to work hard to rebuild the trust of New Zealanders.
Right, couple of health matters, if we can. The business, I don't know if you saw TV3 last night, it was a good piece, throat and nasal swabs. We are still, despite reassurances from the Prime Minister yesterday over PPE gear, kits, access to it, there are still crying out in the medical profession for the stuff they need. Why is that happening?
There's been a challenge as we've moved from a peacetime fronting to effectively a wartime fronting, where we're sourcing things nationally and in a globally competitive situation where everybody wants these products rightly. We have been able to continue to get supply of them, and then the challenge has been to distribute them effectively around the country.
I don't understand that. So we've been reassured you've got supply. So supply is not the issue. Distribution appears to be the issue, and yet doctors are saying they order 50, they get 5. That's supply, not distribution.
The challenge has been to make sure that they are around the country, that people aren't stockpiling them, that we actually have them where they're needed, when they're needed, and those systems are being sorted out.
But when you say systems, they're called couriers and trucks and cars, and it's not a new invention. You're not reinventing the wheel. Why is distributing something you've always distributed suddenly become so problematic?
There are significant logistical challenges in moving from a situation where the core health system was the only area that was being supplied to a situation where we're supplying also the private sector with things that they might previously have sourced themselves. We were scaled up dramatically with large numbers of community-based testing stations. Our ability to do tests has gone up threefold in the last couple of weeks or more. We've just ramped up hugely, and that's the efforts of the frontline health workers. And I do want to acknowledge the hard work that they're doing, and that's why it makes my particular errors all the more gutting.
Appreciate your time very much. Health Minister David Clark with us.